To begin our second panel, I'm delighted to welcome Mr. Timothy Charles to Washington. Mr. Charles is President and CEO of Mercy Medical Center in Cedar Rapids, Iowa. Mr. Charles has significant health care experience. Before coming to Mercy, he was the CEO of a large community hospital in Texas. Earlier this spring, Mercy was recognized by the Commonwealth Fund as a, quote, high-performing healthcare organization because of its low readmission rates for heart attack, heart failure, and pneumonia. So, Mr. Charles, we thank you for your commitment and for your being here today and your testimony. Mr. Charles, welcome.
Senator Harkin, Ranking Member Enzi, distinguished members of this committee, thank you very much on behalf of Mercy Medical Center for inviting us here. One of my intentions this morning is to provide you a greater sense of confidence that there actually is extraordinary work underway already within community and community hospitals like ours that are already having a significant impact on the quality of health care. Mercy was founded by the Sisters of Mercy in 1990, and for the past century has devoted itself to the healthcare ministry of caring for the sick and improving the health of the communities we serve. And I would be remiss if I didn't say that we are as concerned about the vitality of our community as we are the health of our residents. And Cedar Rapids is still recovering from a devastating flood in 2008, and we continue to need your help. The themes that thread the way through the long and unbroken history are that we stand upon a ground of compassionate service, but we do that through state-of-the-art care, the science of medicine that's made possible by extremely talented providers, as well as the generosity of a community that ensures that we have the very latest and finest tools that are necessary to deliver that care. Just 1 year after evacuating the hospital as a result of the flood and rebuilding it, we were invited by the Institute for Healthcare Improvement to present our path and results and to achieve its recognition by Don Berwick, along with our competing hospital and the medical community, as one of the leading providers of high-quality and cost-effective care. In a subsequent presentation, I shared that Mercy's accomplishments were the result of years of dedicated effort and discipline. This invitation led to 2 additional meetings in Washington with colleagues from a select group of communities chosen as they might offer innovative models to an industry desperately in need of reform. The recent Commonwealth Fund case study released in March and April of this year, recognizing Mercy as being in the top 3% of all facilities with respect to low readmission rates, is further testament to the relentless commitment to quality improvement. Looking back, the pace of Mercy's commitment to quality improvement accelerated dramatically beginning in 2003 with our joining the Institute for Healthcare Improvement, Dr. Don Berwick's initiative, in devoting ourselves to improving the health of our community, the patient experience, while also reducing costs. Today, we can also look to the Partnership for Patients' intention to improve quality, safety, and affordability, and I'm pleased to inform you that Mercy Medical Center is a member. This, in no small way, our accomplishment, our community's accomplishment, has been the product of a dedicated medical institution functioning in a rather unique community where sharing knowledge and initiatives that improve quality is common. The cross-cultivation has assured that all of those best practices are distributed to both hospitals as well as to all providers and clinics. Specifically, with respect to treatment, the principle in play is to get it right the first time, and to ensure that the treatment process is managed before, during, and after acute care. For example, 100% of Mercy's 85 primary care physicians are utilizing an electronic health record. Health coaches are now embedded within these practices to augment and enhance the physician's capacity to effectively interact with their respective patients to better manage chronic disease such as diabetes, congestive heart failure, and to drive wellness and prevention initiatives. Additionally, chronic disease management self-help courses are held throughout our community, led by Mercy trainers, supported by a curriculum developed at Stanford. Every Mercy employed physician is on an incentive program designed to improve compliance with evidence-based practice. In the event that acute care is required, a myriad of initiatives have been undertaken to ensure top quality. Adopting the technology of lean, the facility is constantly challenging its performance and instituting initiatives that are evidence-based, standardized, and hardwired. We have deployed additional resources to the floors, such as pharmacists to work side by side with nurses. We have actually developed new services within our community, palliative care. We opened a 12-bed hospice house. We also have reached out to other organizations to bring to Mercy the evidence-based practices that do make a difference. For example, the American Heart Association's Get With the Guidelines project, which encouraged us to reach beyond the walls of the hospital and to bring the local ambulance company into a conversation for how we can improve cardiac outcomes by beginning care in the field. You may have noticed that a number of the initiatives are in some ways reflective of the 9 focuses embedded within the Partnership for Patients Center for Innovation. With each successive year, blending technology and lean process improvement, the hospital environment has become safer and more reliable. Process improvement coupled with advanced technology from robotics in the pharmacy, computerized smart IV pumps, bedside medication verification, and barcoding, Vocera communication systems. The organization has grown in its sophistication. The Commonwealth Fund's interest in readmissions and the subsequent identification of leading institutions is an important indicator of overall success in managing the clinical process. This success, from our perspective, is the cumulative consequence of striving for and achieving many varied certifications and designations of expertise in specialty programs, and I could list a number of those. These designations are important for the recognition that specific requirements have been met, a high standard of care has been measured and verified, and the commitment to excellence has been sustained. We've also committed ourselves to transparency, sharing data, benchmarking, and also research. We've been involved with Mayo Clinic for 25 years with cancer research. But once a patient departs from the hospital, the work doesn't stop. Mercy's process improvement teams have been working on 2 specific initiatives, post-discharge follow-up for home care, and also, particularly for high-risk patients, and the other is the use of home-based monitoring systems that provide data that alert clinical teams to patients' progress or deterioration, and that has actually reduced the readmission rate within that population by 47%. It's true that Cedar Rapids is somewhat unique. We share one medical staff, one group of specialists. 4 years ago, Mercy brought to our community an innovative information technology product called Patient Keeper, which enabled us to share data. It's an overlay that allows us to communicate across all facilities. We're also now developing a patient portal, which will enable patients to engage in their care, which is particularly important to Senator Harkin, your initiative with respect to health and wellness. So the future will bring significant investment in information technology, increased engagement across the spectrum of services, and finally, the medical home will be embedded in every primary care practice, and that will, in effect, ensure that these initiatives are driven home and the results that we are committed to are achieved. I think that there's an authentic sense of leadership and opportunity right now within the medical community, particularly within the hospital industry. And I'm very excited. We're at a tremendous juncture, and I think the future is very encouraging and positive. Thank you very much.